Good evening, namaskar, adab, sat sri akal. Welcome to the Miraculous Monday live session number 6 of the 26 episodes we have planned to take in the first half of the year. So I hope you are actually liking the previous episodes. This gives me encouragement, the kind of feedback, the kind of positive comments I received on my WhatsApp, in my groups to an extent, and sometimes on page as well. All combined do really send me a good message that probably I am on the right track. Again, this is one part of the series which I've taken as an additional payback to my profession. You have been seeing my YouTube videos, you have been seeing my webinars, you have been, you can say, witnessing my other modes of communication with you. But yeah, this is slightly different. This is slightly different than, you can say, it is longer than a YouTube video of 5 to 7 minutes and shorter than a webinar of 60 minutes. So it is somewhere between 20-25 minutes. So we come each year and we actually, you can say, go about discussing. I take up a topic, sometimes medical legal, sometimes practice management, and I go on discussing the same with colleagues, with friends, with dentists, with the fellow, you can say, members of the community. So what exactly do I have in store for today? Just let me check once whether I'm live or not, then we can go ahead. Yeah, we are live. Yes, since 1.5 minutes. Thank you so much. So friends, just allow me to share my screen so that I can actually go ahead and share the concept with you. This is a very interesting topic which I'll be taking up today. It's surely going to be a very interesting topic. So welcome friends once again officially to Miraculous Mondays or Management Mondays. Destined to be for 26 episode. This is episode number 6, and we cover short topics of practice management and or medical legal aspects or ethics in dentistry. So today, Monday, 7th Feb, we are at our usual time of 8:15, 8:20. And before I start my presentation again, as usual, my big thanks is due to Lord Almighty, who's given me much more than what I deserve. So this is my brief CV, gives me a little bit of authority to tell what exactly I am actually, say, why is the reason that I'm divulging a few things before you, which is the capacity that actually gives me this much amount of, you can say, audacity to cover the same things with you. So what is the topic for today? Today's topic is patient satisfaction. Exactly speaking, patient satisfaction is a very vast topic. Whenever I take a workshop, if I'm taking you can say an advanced level workshop, patient satisfaction takes more than 4 to 6 hours. In a short, maybe around 1 to 2 hours. But I'm not here for 1 to 2 hours. I'm just going to give you a very, very unique concept, which is, you can say, embedded in patient satisfaction. But before that, just let me lay out the questions for today. What exactly are we going to discuss? So what is patient satisfaction? Is it a benchmark in our healthcare industry? Does patient satisfaction play a role in the way healthcare service providers are judged these days? And can we actually measure patient satisfaction, or what exactly is my stand going to be today? So these are a few points to ponder that I'll be discussing today. Of course, we all know that it is actually being rapidly recognized as a new benchmark in the effectiveness and efficaciousness of a clinic. How actually, you can say, we are able to satisfy our patients and retain them, that is a big benchmark. And of course, it leads to judgment. The common line says, doctor may have done a good treatment, but I am actually not satisfied from that dentist or doctor, whatever you can say. Of course, I'm saying about the healthcare industry, not exactly the dentist itself per se. So this is the commonest line. Even if though you have done the best treatment possible, charged less or high as per the patient's desire, still the end result might not be satisfaction and a complete one. What exactly is the reason for that? So practically speaking, you can say sometimes the perception of the care can be equally or even sometimes bigger than the quality of care. Of course, there is no substitute for the quality of the care that you're going to accord to your patients, to your, you can say, loyal patients, or not even loyal, the routine patients, or all of them rather. But sometimes the perception that the patient makes out of your treatment, how he was treated, SAB and VSAB. SAB means treatment wise, VSAB means behavior wise. So actually both of these can help create a bigger, or a, you can say, a perception which is not actually in sync with your services. So you can say in coming times, we may have actually PSSS, as they say, patient satisfaction scores in the clinic, which can actually become fundamental in selecting. But then let's see the flip side. What actually leads to dissatisfaction other than many other components? I'll be dealing with one such component today. And we commonly see patients complaining. Expect the worst, hope for the best, be prepared to wait, be uncomfortable, and be ignored. In one line, actually, the summarization of the long waiting times of the clinic has been done. I remember when I was, you can say, studying, I used to see my dad actually taking a half day leave to go to his dentist. And I used to ask, Dad, I heard that the sittings are longer, so you must have taken an appointment. He said, yes, I've taken an appointment, but still I would have to go and wait for 2.5 hours there. Said, why don't you go 2 hours early, or 2 hours late only than your designated time? For example, it is 2 p.m. So why don't you go at 4 o'clock straight away? Said, you never know, he can call at 2:30 also sometimes, do something, and then disappear for 1 hour and doing other patients, and then maybe he'll come back at 4. So I have to be there at my appointment time. So I used to wonder what exactly it is. So probably when I started my clinic, it started of course, we start the clinic based on our footfall only. We cannot actually afford it. Plus, my town being an industrial town, people actually don't value much time in Punjab. Broadly speaking, not exactly, you can say finely speaking, but broadly speaking, people don't value much time in Punjab. I'm talking in the early 2000s. So yes, it was a difficult task to make them say come on appointment space, appointment time. But once it was settled, I'm really reaping those fruits for the last 14, 15 years. Ever since my clinic is in 23rd year, but my appointment system is in 15th year, I would say, and strictly speaking, and I can vouch for it proudly that 90% of my patients come on time, and that component of coming on time and not waiting much is a big factor sometimes. So yes, these are a few points to ponder, but what exactly? We all know that actually being a dentist has its own set of challenges as well. We usually have three jobs on our hand. Firstly, to deliver the best possible quality care. Then, of course, keeping the patient informed. And then, of course, the experience should be A1, A class, international standard, or whatever you can say, the patient should be comfortable. So that is the bottom line. So it is, you can actually say, I'm not an MBA, I'm not a manager. How can I actually deliver an experience which is in sync with the patient mindset? I don't know the patient. So again, this tells you the fact that you need to know your patient very well. So informing the patient again, sometimes patients keep on waiting for long, 1 hour, 1.5 hour. Nobody actually acknowledges them. In Western world, this is treated akin to an insult, that as if it did not exist. We are sitting and nobody just acknowledged also that what exactly was there. So is it, you can say, is it enough? No, this is not really enough. So what is the solution? So one of the practical solutions is the ASAP phenomenon. So of course, we all know as soon as you can or as soon as possible is the normal explanation of ASAP, but it's not. It's not. ASAP is something different. The ASAP solution actually gives you an insight into the clinic waiting area, clinic arena. Margaret Sumption, a European teacher and a counselor who has 35 years of experience, now must be close to 39 years of experience, I would say. She actually summarized 4 critical components of patient satisfaction, which she called as ASAP. Of course, I'm giving her the due credit and the phenomenon belongs to her. So, which can help us accomplish all the 3 components. Number 1, the quality care. Number 2, keeping the patient informed. And number 3 was the comfortable experience to the patient. So what exactly does ASAP stand for? So you can say really whether as soon as possible, as soon as you can, or what exactly it is. What let's see. So A stands for acknowledge, S for support, A for accept, P for prepare to act. So this is in short the ASAP phenomenon. Margaret Sumption has given it. And actually speaking, this actually summarizes the whole process from where the patient journey starts in your clinic. And this is not a small thing. This is, again, these four words cannot actually summarize the whole experience. But how does it go? Let's see. So A, as I said, in Western world, you can say people like, you can say, compare the same, the wedding part. There is no greater insult than to be ignored. You're coming and sitting in the wedding and nobody is coming to even acknowledge your presence. You felt like invisible. And just a small eye contact with the patient, just a small wink, a happy one. Of course, the mask, the patient can't see our smile. But yes, sir, an eye wink, an eye gesture, like thing, just to make the patient feel assured that yes, we understand, we know that you are there. And then, of course, if you are just getting over your job of the previous patient, just winding up, giving instructions, or probably just closing up the previous patient, you've done the work. Just a thoughtful look coupled with a smile, and actually, you can say just a small empathy, which the patient needs. That yes, I've not been forgotten, and trust me, just takes one moment. And somebody who's actually come to you, he's not, you can say, free. Anyways, he's come because he's in distress. He needs you. He might be in actual trouble some of the times. Then the second is support. Set a no ignore rule in your clinic. If the patient has been sitting for more than 15 minutes, ideally they should not. Ideal waiting time should not be more than 5 to 10 minutes. But if he's sitting for more than 15 minutes without actually someone engaging with the patient, you are sure to get a negative review. And trust me, it takes only a second. On the Google review, the patient's hands are actually on your, you can say, death warrant in her hand, and she'll immediately say, poor service, not even been acknowledged, waiting for so long, the dentist is busy, the appointment given, the patient not cared for, the customer care is not important, blah blah blah. This can continue, the rant can actually continue, but the rant might be justified actually. So just set it. Probably you can just convey through your staff, yourself. It is just taking a little longer than expected because of the emergency or because of whatever reason. Ideally speaking, you should be having a buffer of 15 minutes between your two appointments, so that even if the previous patient gets prolonged, you can actually make up for those 15 buffer minutes. But even if it goes beyond that, you should surely do this thing and mention to the patient that this is because this was an emergency we dropped in. He was in serious pain. So we just took that patient out of turn as a humanitarian grounds. And trust me, patients won't mind. They will rather have more brownie points for you. Yes, he's actually dealing the patient in an emergency. God forbid, I have an emergency tomorrow. I will actually understand that. I will be also taken care of in such a manner. The best way is offer a glass of water, offer a cup of tea or coffee if you're dispensing, offer to tune into the patient's favorite TV channel or whatever, just for the patient to actually be engaged for some time. This is to be set as a no ignore rule in your clinic. Then third is accept. We need to accept the delay. Sometimes some patients might not react very, very kindly. They will actually, they'll have their tempers blown out of proportion. But then you need to understand that a simple acceptance of the fact that yes, it is our fault. We duly understand it and we really apologize for it. Just acceptance of the thing is one thing. When you actually try to, you can soothe out the tempers. On the contrary, if you try to, you also came late last time. हमने भी तो आपको adjust किया था. फिर क्या होगा अगर 10 मिनट हम late हो गए इस बार? That is a wrong attitude. Actually, you can do that. But when you try to shift the blame or the focus, the trust is that I got late because I had an emergency. You got late because you are doing it genuinely. Then this argument thing may start. So it is better to accept with all humility. We all know that medical science, dental science is not an exact science. Sometimes it does take more than the requisite time, more than the allotted time. But the pure thing is to accept that and just inform the patient, convey the patient that yes, this is the reason. And trust me, the patient who's sitting in the waiting might be in pain. He might be actually willing to get a pass through to you early, and here he has to wait. Just soothe him that even the one who is in the chair, he also was in a similar distress. So we just need you to calm it, and whatever way you can calm it, because the tongue does the wonders. If you can soothe the things with your tongue, of course, not with an excess of sugar, I would say, but just the normal sweet tongue can do the wonders. Patients understand that we are in a healthcare profession. We are not surfing internet or watching TV inside. We're treating someone. We are with a human. We are with someone's teeth. So it might take regular that. But then make sure that this does not happen every time with that patient or with most of the patients. That is to be there. Then prepare to act. For example, the procedure you are doing inside has taken more than the desired time and is supposed to take, you can say, more than actually even that slot of the patient who's just walked in. Probably it was a extraction with normal extraction with turned surgical, and the surgery is going to take some time. So the best thing is that always assess how much time are you going to take on the chair of the patient in chair who is actually being treated right now, and just inform the waiting patient that we are actually very sorry. This actually happened suddenly, but then we can adjust you in that time. You can offer what exactly makes the patient feel comfortable. If the patient is ready to wait, and if you have a slot later on available, just adjust the patient in that slot. If the patient says, no, I'm sorry, I have an important meeting after an hour. I thought that after my treatment from here, I'll go straight away to my meeting. Offer to, you can say, adjust the patient in any other schedule. That is the best you can do. Of course, that is the reason I always tell, don't keep your extractions, don't keep your surgical extractions in the middle of the schedule. They are normal extractions. Sometimes they may become surgical. So this is the reason to actually, you can say, go about a certain sequencing of the task that I tell. So, of course, all these things are interconnected when we discuss all these. But then you actually get the patient gets the confidence you are actually doing the big things well. It actually is their is their thinking part, and that is where we actually need to get into the patient's mind that you were acknowledged and we are taking longer than you can say expected, and yes, it might be an emergency for many of some. So just summarizing a little bit, what exactly is ASAP? Acknowledge that the patient is important with your eye contact, your gesture, a wink, or you can say just a movement of your eyeballs, and actively engage the patient through the staff member. If you can't do that, just make a gesture yourself and engage the staff member to convey whatever you want to convey. Then support can be through you, can be through your staff, through your kind words, gestures, and interaction. And third, accept what the patient reports as their truth. And fourth, be prepared to act with a kind gesture and action to make, you can say, the patient should be less stressful and opt for an additional sitting or additional time. So a simple solution which can actually deliver, you can thoughtfully deliver in a very, very timely way. So what was the topic for today? What is patient satisfaction? It is the sum total of all the patient experiences of the clinic. So is it a benchmark in healthcare industry? Hell yes. It is becoming a big benchmark in healthcare industry, and not only dental, medical, but all the, you can say, sister concerns of healthcare, you will say, of medical and dental. So does patient satisfaction play a role in the way healthcare service providers are judged? Yes, he might be the top notch, he might be the expensive, but I was not satisfied by that patient. That may be the commonest answer. Probably the patient experience was not good. Your internal marketing factors were not good enough. So can we actually measure patient satisfaction? Yes, we can measure it. I gave you a formula in my first two sessions. S is equal to P minus E. David Master gave this first law of service, a European Harvard professor once again. So S is equal to satisfaction, P is equal to perception, E is equal to expectation. So S is equal to P minus E. The patient walks in a certain kind of expectation to you via referral, via whatever way he just reads about your credential, he sees your ad or whatever. He walks in with the expectation. The way he's treated, SAB or SAB, as I say, via your gestures, via your internal marketing factors, and your treatment part. So both the parts, he creates a perception out of that. If that perception is more than the expectation, the resultant test would be surely positive. So yes, to summarize with the carry home Gyan, it has become one of the, you can say, most important primary goals. And it is directly proportional to your success as well. And because satisfaction will impact patient retention, clinical outcome, and of course, the referral chain part. So, and trust me, these days, the patient's expectations are also on the rise. So you can say we all have to set new benchmarks for convenience, comfortability, transparency, quality, and there have to be, you can say, plugging of the gap between expectations and the reality, which actually is now being, you can say that a benchmark is being created in that sense. So sometimes in the quest of improvement, you can say investing in new services and processes becomes a tedious task. But sometimes that does not necessarily give 100% result. That yes, we employed the latest machines. So what do I need it? I don't need it. I was getting good treatment done earlier. But ever since you have invested in these two new machines, you are getting more busy. You are not dealing in the same way as you were earlier. This might be the patient response to your actual new investment made in the clinic for the comfort of your patient. You might have become more mechanical in the clinic, but you have become less humane. That is the difference you need to understand. So we really need to have an honest assessment of our practice and always try to look at the clinic or the practice through the patient lens, because sometimes just a few changes can actually bring about a huge difference in the patient satisfaction levels. But sometimes bigger ones won't even, you can say, meet patient's eye approval, but a smaller one can actually do the trick for you. So I hope it was actually putting you to think more. And if you have not been following the ASAP phenomenon, do make sure that you follow it from right from tomorrow onwards. So my topic for the next session will be a continued with this part. It will be 10 essential elements of patient satisfaction. It will be a continued format in the next Monday, episode number 7. So till then, आप लोग लड्डू खाइए, as I always say, Ashram web series that I have been fond of. So thank you so much for watching this patiently. Before I stop my share to acknowledge the visitors on my page, let me just give you a few announcements. So I've been running two WhatsApp groups. Those groups will complete 4 years in a couple of days' time. They started on 9th Feb 2018. So right now the 6th group is almost about to be filled, and once it is filled, there'll be no more ingos in this. So if you want to be added, these are purely advertisement free groups where even my own workshops are not promoted. So if you're interested in pure education, just message me, I'll add you. So this is my YouTube channels. Many of my audience have been through with, you can say, YouTube also. So a channel with about 2,500 subscribers and about 6,000 plus hours of watch time. So, and 410 videos right now, as you can see, on 31st Jan. So if you like my channel, go ahead, subscribe to it. I keep on posting these videos very frequently. So do send me your feedback on my number, on my FB page, on my WhatsApp group, wherever you're watching me, or in any other group, or on the, you can say, or on YouTube later on. So do send me your feedback, because and brickbat both would be welcome equal in my ear. So thank you once again, and I stop my share for questions or acknowledging the visitors on my page where this session is actually being streamed live. So hello Manuji, hello Dr. Nimesh, hello SP Singh sir, hello Ajay, hello Balwinder sir, hello Twinkle ma'am, hello Ramchandra sir. I hope all of you watched this session and you liked this session. So if there are any queries, I'm just waiting for a couple of minutes, and then we can actually go about the task of going ahead. So thank you so much. So thank you so much, Balwinder sir. Really appreciate your heartfelt feedback. So anyone having any queries, please go ahead, and then we can actually go ahead with our I can go to my family after that, because that is my family time after all, which I'm just sneaking in at 15-20 minutes from that. Okay, so okay, thank you guys, thank you for watching. So we meet on Thursday with the Thunder Thursday episode with another topic of finance. And for patient satisfaction or Miraculous Mondays, I see you in the episode number 7 next Monday, same time, 8:15, 8:20. So on my page, be there. Thank you. Take care.